Good morning. Welcome to another OTS GCMIO monthly training session for the 8-minute Clinical Information System Trainer. My name is Mr. Salceda, Richard. Today's topic, we're going to talk about CHAS and Proactive Patient Management application. This session is being recorded and will be available for those unable to attend on our site for your playback. Purpose of this session is to provide overview of proactive patient management module and function. And that's basically, it's going to be it, is an overview for those who have never had any time or worked with PPM. Upon completion of this lesson, students will be able to identify primary use of PPM, access the proactive patient management application, identify the 6 PCM population reports, create a criteria list, save a criteria list, and export a criteria list as a spreadsheet. In the previous session, we covered the following topics: CHAS getting started, setting preferences, appointment module, how to successfully create, edit, clinic health teams, how to track overdue clinical services, and list management module. Let's talk about security keys. To have a CHAS security keys, first of all, you must have a CHCS security key or a CHCS account with all the appropriate keys. And to add that, let me reiterate, I've said it in the past, is that any key that has a Kilo Whiskey or KW in front of it is a CHAS security key. But for proactive patient management, you need the following keys: KWMS1, KWN1, KWT1. And these are keys that can be assigned to you through your CHCS administrator. Okay, what does proactive patient management module do for me? Okay, it accomplishes the following. It tracks patients with chronic illnesses and those who are overdue for clinical preventive services, such as pap smears, colonoscopies, breast exam. And also auto-generate contact letters and diabetic report cards that can be mailed. That is to remind your patients, send them out, say, by the way, you're due for a new glucose study or you are due for a colonoscopy, please make an appointment. And that is really a easy way to track chronically ill patients and also, identify them, track them, and also you can help them a lot better due to better patient care. Auto-generate population health records, as well as CPEGs and HEDIS metrics. Those of us who do stats and trends and rates, this works really well because you can save the CPEG and the HEDIS metrics in an Excel spreadsheet, and then you can do your pie charts, your pivot tables, and so forth and so on. And for those of you who don't know what CPEG is, it's coding procedural groups. Last but not least, we can view patient information gathered from CHCS, and it can go down as up to 5 years in the past to pull any clinical data on your patient. Any questions on primary use for Proactive Patient Manager? Okay, let's move right along. Okay, at this time, we're just going to go into login procedures. I go to my CHAS web portal. I logged in. Once I logged in, I'm going to see if there's any user alert information that is required for me to understand that. Is there going to be updates, upgrades, any new applications? I'm going to click on continue. And once I go to my dashboard, I can actually go to my proactive patient management and click on it under my apps. Now, to have all these applications, you have to go to my account, my applications, and load those applications so you can see them under apps. And there again, you must have the appropriate CHCS keys for those applications. And this is my proactive patient module, okay? And you notice right off the bat on the screen is that you will see Kaysville Medical Center or any MTF. You can hit the drop down and select the MTF that you serve. This is a training site, so it's Kaysville Medical Center, and we'll click on continue. Select Kaysville Medical Center, and I am now logged in. Okay? And now, we have these red highlighted words that say reminder what PPM does for you, and we'll talk about that in a minute. And also reminds you that navigation through the CHAS portal is done by the menu tab or the bar up the top, because if you use back, you will be logged out. Let's talk about the 6 reports that PPM or proactive patient management can do for you. These are the following 6 reports. First report is enrollee list module. That is, you can keep track for your clinic, for your team, and your provider who is all enrolled, and also that you can keep track of your chronically ill patients. High utilizer list module. Now, high utilizer list module is exactly that. What it does, it keeps track of how many times your patient, say like you have somebody who is asthmatic, and they've come to your clinic twice in the last month. But if you pull a high utilizer list module for your provider under which that patient is, you notice they've been to the MTF for the last 5 times in the last month. So that way you can keep track of all your patients that go through the emergency room. Diabetes list module. Yes, you can pull all your diabetics assigned to your provider, to your clinic health team, to your clinic, and your MTF. All those who are test positive for diabetes. But there again, data in, data out, all information must be entered into CHCS. So that way, CHAS can pull all that information. For instance, if a patient is suspected of being diabetic, they could fasting blood sugar, and they notice that the glucose is too high. It's a confirm for their diabetes, and they document in CHCS. As long as there's a put in CHCS, CHAS can pull it out. Asthmatic list module. Yes, it will pull all asthmatics assigned to your provider, health team, clinic. And you can keep track of them, but they're also too under asthmatic list module, keep track of how many times they've been to the emergency room for emergency treatment. Prevention list module. The prevention list module is one of those little applications, widgets that it reminds my patient that, by the way, you're due a colonoscopy, by the way, you're due a breast exam, by the way, you're due another glucose test. And it can pull all those patients chronically ill and or do tests, and you can keep track of them and say like Mr. Johnson was due a glucose test for last month. He pulls them out, the list will say overdue. You can call him up, send him a letter, remind him, by the way, please give us a call to set you up for another glucose test and a follow-up appointment. Others list letters. But again, that is the other part of the PPM that I can pull all my overdue patients on clinical preventive services. I can either send them a letter or I can send them a card. This is done with the patient's name and data and address. Okay, it pulls that automatically. You do not have to go manually line by line or letter by letter and put in that information. One of the things that under the bottom of this slide says, reminder, proactive patient management tool is used to assist in the management and health of your patients. It is not intended to replace a medical record. The data should be confirmed with the most recent information available in the EMR. What that indicates or states is that all documentation should not only be done in CHAS, but also should be done in CHCS, if applicable. Okay? Remember, data travels from CHCS to CHAS, not the other way around. If you put any documentation or indication in CHAS, you must also put it in CHCS. Any questions on this slide? Let's talk about the first application or widget within PPM, the enrollee list. And what this does for you is enrollee list, patients by your provider, total enrollee list for a provider in the MTF, in other words, all of your patients. The difference between the first enrollee and total enrollee is total is all my patients, enrollee specific patients. Third line is current status. Okay, what is the status of my patient on their diabetes, asthma, PAP, breast exam, so forth, so on. Now we'll get more specific from a general list to a specific list. Now also too, the next one, current status chart, is a nice little chart of what it is. It'll take all your patients that are within an age group, glucose, diabetics, asthmatics. It'll give you a percentage chart to display. And yes, you can also save it on a Word or a Excel spreadsheet. So if you're one of those people who like to keep track of statistics. The PCM progress report. It's a chart to progress compared to HEDIS standard. What that means is all my patients at this standard compared to my HEDIS standards. Whoever set up the HEDIS standards for your system says, okay, out of a population of 100 people, you should have only a certain percentage that are chronically ill, and that's what that progress report does for you. Just keeps track of what's going on with your patients statistic-wise. PCM reports by provider group, and that's exactly what it is. List primary care element groups within the MTF, all the patients, like health team, Echo, health team, Delta, so forth, so on. Just keeps a track by provider group versus provider. Any questions on proactive patient management enrollee list? Okay, at this time, I'm going to go through some slides and then I'm going to demo the enrollee list. I go to my PPM menu tab, select enrollee list. And once I go to my enrollee list module, I select a provider. Once I select a provider, I'm going to click OK. And this is a enrollee list patient roster. And if you notice, the primary care manager is Amy. And I have last name, social, date of birth, age 6, PAP, manual, retinal gland, A1C date, home phone note. Now this is just a basic list. The more specific list we will get down further down the road. And you notice we got names and all that information underneath. And this is exactly what it looks like. And you can print this out for one provider or for all your clinic. Okay, at this time, a provider in your clinic has requested a list of assigned patients. You will need to retrieve an enrollee list report of patients assigned to the provider. Little note, for all scenarios, you are assigned as the nurse in the family practice clinic. The equipment required is, for all assigned scenarios, a computer with access to CHAS portal. At this time, I'm going to go ahead and demonstrate it. I'm going to hit accept. I'm going to go ahead and log into my CHAS portal. I'm logging in at this time. I'm going to hit my continue. If you notice under my user alert, I have quarterly maintenance to be looking out for and a PRT update. I'm going to click on continue. And you notice on my portal dashboard I have a couple of widgets set up here already, but that's not what I want. So I'm going to go up to the left-hand corner, my apps. I will go down to proactive patient management. Now I'm going to select my MTF, which is already selected for me because I only have one MTF in this web page, which is Keesler Medical Center. I'm going to click continue. And now I'm at my proactive patient management module within CHAS. There are my red highlighted letters, my reminders, navigation. I will go to my menu tab. And you notice under my menu tab, I have three major tabs: PCM population reports, high utilizer reports, my diabetic reports and subunits, my asthma report, my prevention report, others list letters report, links and definition, and last but not least, help. Now this is where you will maneuver when you're within proactive patient management, is off your menu tab. So one of the reports that we're going to talk about right now is our PCM population reports. Let's go to the enrollee list, click on it. And we're now in the enrollee list module. I'm going to hit my drop down. I am going to select a patient or a provider. I'm going to select Amy. Once I select her, click OK. And what it's doing now is pulling all my patient data off that enrollee list. For my patients. And here is my PCM patient roster for my provider, Amy. As you can scroll down from my demonstration, that all the information that we just talked about is pulled up. Last name, first name, social, date of birth, age, sex, PAP date, mammy date, rental, and so forth, so on. First patient, which is Abernathy Demi. Notice that the patient had a colostomy on given date. Albright Bridget, there again, had a hysterectomy on given date. Now, if we're going to print this out, be advised to be aware that some of these pages go from 1 to over 1,000, and be selective when you print this data sheet. Because if you say all, you will get 1,000 sheets worth of reports. Now you also notice here on Baird Lisa, the system did not find no PAP. That indicates that a PAP was never done or it was never entered into CHCS. Okay, it was done, but somebody forgot to enter it. It will find that data information for you without you having to scrounge through the records and saying, oh yeah, this patient is due, so forth, so on. There again, I have another patient right here, Benedict Jennifer, no PAP found. It'll find this information for you without you having to dig into a report. Okay, I'm going to go to enrollee demographics. And I will show you what enrollee demographics does. There again, I will select patient or a provider, Brian, click OK. All your reports, majority of them will be in PDF format. And you notice for the primary care manager named Brian, here are his patient demographics. And this is there again, if you're into stats, this is a great report because you notice here you got patients from date range to male, female, total release. This provider has 1,412 patients within his, that he sees, he or she sees. Talks about population health portal chronic illness counts, your beneficiary category, and it also talks about your immunizations prevention categories. This is a nice little stats report for those of you who are into stats. Now, total enrollee demographics is, instead of for one provider, now we're talking about our clinics. Okay, the next report is current status report. There again, that's a nice little report. I'm going to click on it. Didn't come up. There you go. And we'll say for primary care manager clip. Once my PCM is selected, click OK. And another PDF chart will come up. And you notice here now, we're talking about percentages. We're talking about stats now. You notice on my A1C or for my glucose, I have 83% that have been done. I have now within limits on my LDL 100%. So on there again, this is a nice little report if you're into stats. Now the one that I really do like is this one right here, PCM current status chart. I'm going to click on it. I'm going to select me a provider. This time will be current. Once I select my PCM, I'm going to click OK. And you notice that here is my current status chart for this provider. And apparently covered does not have any patients except for this one bar. I'm going to select another one that I know has patients. And there again, there is my patients here. And down here we have a legion for diabetic, A1C, hemoglobin control, diabetes, so forth and so on. There again, this is just a real nice little chart. Hold on, ladies and gentlemen. Ms. Linda Guest says to remove a deficient preventive screening test that was performed from the numerator, does the provider need to go into Alta and add the diagnosis code or problem code before? What do you mean by deficient screening test? You mean that it no longer applies, Ms. Linda? Okay, that was performed in the network. Now you remember, CHCS pulls all its data from, CHAS pulls all the data from CHCS. So therefore, any information, it's a twofold thing. If there is an error, say like a test that no longer applies in CHCS, you have to go to the CHCS administrators and the CHAS administrators to work that problem out. I hope that answers your question. But I don't think it does affect Alta, because Alta is its own outpatient application. I hope that answers your question. Okay. Any questions thus far on the reports we have here? Now also here too, you can pull current status. You can also pull PCM reports by group name. Like I said, this is a great little enrollee status if we were into stats. Okay, let's move right along. Let's talk about the high utilizer reports. Okay, the high utilizer report tracks visits to the MTF by patients for selected PCM. It's also a reference which includes last name, first name, social date, date of birth, chronic illness, benefit category, home phone, work phone, age 6, pap smear, breast exam, total visits a year. Now there again, this is great for your diabetics and your asthmatics, just in case, say mostly for your asthmatics, because if they only be doing 1, maybe 2 visits a month, if that, for your clinic, but you notice it to the ER, they've been going 3, 4, 5 times, something's going on here that it's not being taken care of. And that's how you would track your patients. All right, I would go to high utilizer report. I would select me a PCM. Click OK. And this is where a high utilizer quick list is. And that's exactly what it is, just a quick look at, you notice here for private care manager Clint, last name, first name, what my chronic illness is, my date of birth. Oh, by the way, DDS is FMP, family member prefix. Gender, number of visits. And here, for, let's say on Elliot, we've had 13 visits for the last year. I would consider that a high number due to the fact that something's going on, that patient is not being taken care of. Samuel Sandy has 18 visits per year. There again, something that might be taken care of. This is a quick shot of looking at what's going on with your patients if they've been visiting the ER and not letting you know what's going on. Okay, scenario. A provider would like to track clinic visits for his patient using the high utilizer report. You will need to print a high utilizer report. And that's exactly what we're going to do. So I'm going to go for my current status chart. Click on high utilizers. Select high utilizer report. And I know that my primary care manager, Amy, has a lot of patients. I'm going to select Amy and then click OK. And here is my high utilizer report. Okay, and you notice I have primary care manager as of 31 January 2008. I know it's an old report. And we notice that it goes from the most visits to the least visits. And Frost Jack, who suffers from hypertension, has been visiting the medical treatment facility for the last 30 times. There again, to me that would be a concern, because if he's not being taken care of in my clinic, why is he going to the emergency room? Somebody's not doing their job. Okay? So This is a quick list report. The next list we're going to talk about is the high utilizers full report. And the only difference between the quick report and the full report is this, the last two lines on this slide, the MEPRS code and the CPT codes. That is the only difference besides your diagnosis. And that will give you an idea of what clinic they've been visiting outside of your, as you being a primary care provider. All right, I'll go to my high utilizers tab on my menu, and they click on my high utilizer report. Select a PCM. At this time, I'm selecting Clint, and I want to know all my patients that have been going to the hospital greater than 4 visits a year. I'm going to click OK. And this is my high utilizer report. But again, the only difference is the MEPR codes and the CPT code and diagnosis is about it. And you notice down the total visits a year for this patient is 13. So it tells you when they went to visit, what clinic they went to visit by using the MEPR codes, what was their CPT code, and what was their diagnosis. Now this is a now specific report, and there again, you can track what's going on with your patient. Ms. Linda's guest asked a question. Since TCONs are considered encounters, will it count this as an encounter even though they did not actually come to a clinic? Remember on CHAS, Ms. Guest, yes they are. Yes, they will be counted as a visit. But you got to remember too that the MEPRS code, if it's not there and it's blank, that should give you an idea that that was a TCON. I hope that answers your question. You're welcome. All right. My next scenario is this. It's been determined that the number of patients assigned to the clinic have been going to the ER instead of returning for a follow-up appointment. As part of the HEDIS measure initiative, the provider has asked for a list of all patients assigned to your clinic. You'll need to print a list of patients assigned to your clinic. And we're going to find out who's been going to the ER and who hasn't. I go to high utilizers. I'm going to click on full report. I will select greater than 4 visits. And I will select Miss Amy again. I will click OK. And here is my report. And you notice that this patient, Elliot Archie BQ, has been going for 14 visits for the last year. And also what clinic they were in, the CPT code, and also the diagnosis. There, Lisa has been going for 11 times past year. Now there again, if you want to print this for your provider, if you look at the upper left-hand corner, it says 1 of 36 pages. Be careful, otherwise you will have 36 pages report. So save the trees. That's all I'm saying. Any questions on the high utilizer reports? Okay, we'll move right along. Let's talk about the diabetes report. The diabetes report pulls out all this information: last name, first name, social, age, sex, your chronic cardiovascular diseases, are they on insulin, when was the last time they had a blood sugar level done, their LDL, HDL values, was an exam given for the retinal, was their diabetic usage output, visits, hospitalization, ER visits. They'll pull that data also. their microalbumin, which is an indicator for kidney function, and also if they have a PAP or mammal date. It's a great program. If you are a diabetic clinic, it keeps track of your patients and what's going on with them. At this time, I'm going to go ahead and demonstrate on these slides how to pull a diabetic report. So I go to my PPM menu tab, click on diabetes. At this time, I'm going to go hit my drop down and select my provider, which will be Clint. Once I select my provider, click OK. And this is my diabetes report. Don't worry about the small writing. I'm going to demo a live one. And you notice here too is under A1C, first patient name Elliot, his number, which is 9, is in red. That's an indicator that it's too high. If you go all the way down to the next one, which is Edison Glenn, 7.70, it's in black lettering, which indicates normal. Go to the next patient, McGee Jack, 12.8, which is very high for an A1C value. But again, the system will pull out these values. If it's outside the normal limits, it will show you that in red that it does. That is outside the normal limits. Okay, at this time, I want to demonstrate how to pull a diabetes report. PCM diabetic report. I will select Miss Amy again. Click OK. Pull my report up now. System is looking through for PCM Amy. Give it a minute or two. It's now thinking. And here is my report. Oh, too big. You have to drop this down a little bit. There you go. It can fit. Now you notice that there again it pulls up all my dates and my values for my A1C, my blood sugar, for my LDL, for my HDL, and also my retinal exam. And you notice on the far right hand corner, I have all my microalbumin dates that were given and their values. Then I'm going to scroll down. And for this patient here, Bagley Scott has a high value of 135 for his LDL, which indicates a high value for cholesterol. So again, this report will do all that information for you, indicate high and low values. But there again, data in, data out. If all the information is input into CHAS, CHAS will bring it out. If you notice, this report is 3 of 42. Then again, if I print it, be aware of how many sheets you want to print and what sheets you want to print. Another thing for diabetes, we can do a diabetic report card with lab request. Yes, you can send that out, print it, send it out to your patient. You can also add a network specialist for an HbA1c result. You can also pull a knee retinal exam call list. Let's pull that one up for now. Let's see what we can do with that right now. I'm going to select Miss Amy again. Now you notice I have two formats to which I can pull this report, either HTML or Excel spreadsheet. I will select Excel spreadsheet, click OK. All right, this time it's asking what I want to do. I'll say open. I hope y'all can see that information. Now you notice that it pulled out my information, my values, all my information for this list that I just pulled up. And there again, if you're good at Excel spreadsheets, this is great because you can manipulate your data, put them in whatever order you want, and you can print it out and say, okay, these are the people that I need to contact for this list. And last but not least, on the diabetes, cardiovascular risk with diabetic report. It can pull that information up too. I already did this. And we already pulled up a report for follow-up appointments. Any questions on the diabetic report? Okay, let's move right along. Let's talk about asthmatics. The asthmatic reports pulls everybody that has been diagnosed as an asthmatic. There again, basic information, last name, first name, social, age, date of birth, chronic illness, are they on insulin, yes or no? What kind of asthma med are they on? Are they on steroids? And how many outpatient visits? There again, this is a good report because, you know, the patient might not be talking to you saying, yeah, I'm taking my medication, but actually they're going to the ER because they've been having a lot of emergency episodes. Okay, so I'm going to go to my PPM, go to my menu tab, hit the PCM asthmatic report. I will select a provider. Once I've done that, I'm going to click OK. My provider is my Miss Amy. And here's my asthmatic report. Do not squint your eyes because what I'm going to do is I'm going to demonstrate and I'm going to pull this report out again. Okay, the PA at this time needs to order preliminary labs for all asthmatic patients, and so that they will be seen for next clinic. You as the nurse will print a list of asthmatic patients for the PA. I will demonstrate. Go to my menu tab, click on asthma, select asthmatic report. My favorite provider, Miss Amy.
Your conference is scheduled to end in 10 minutes.
And there again, here is my report. Okay, we can see this now. You notice I have last name, first name, social. The patient's bed, singular, Pulmicort, Flonase, Avatar Discus, no control bed. Steroid dates, number of visits, number of ER visits, and hospitalizations. It's a good report due to the fact that if you're doing what you're doing as a healthcare provider, but your patient is not listening to you and they've been admitted to the hospital the last 2-3 times, at least 3 times within the last year, that you really need to sit down and talk to your patient and look, dude, you need to take care of your asthma, and if you have any issues with your asthmatic, please let me know. Any questions on the asthmatic report? Out of all the reports, the asthmatic report is the simplest, shortest one. Okay, next report we're going to talk about a prevention report. Basically, it teases a list of people who require clinical preventive services, colonoscopies, pap smears, breast exams, so forth, so on. And it's basically the same information: last name, first name, social, age, address, work home phone number, beneficiary category, PAP and smear dates, breast exam dates, colon screening date, who the primary care manager is, and the DMIS code, Defense Medical Information Code, where, what MTF they belong to. Okay, at this time I'm going to pull me a prevention report. So I'll go back to my menu tab, click on prevention. I'm going to select me a provider. Now you notice that again I got HTML, hypertext markup language, or Excel. I'm going to select Excel because I can save it. And this is my prevention report. Don't let the small lettering worry you. I'm going to demonstrate a live one, and that will expand it, and I will show you what it looks like. The internal medicine physician wants a list of chronically ill patients that he or she sees in the clinic. You will need to print a prevention report of CPS services for all chronically ill patients assigned to that provider. At this time, we're going to do that. Under prevention, we have PAP and mammal due list, PAP due list, mammals list, colon screen list. Now there again, you can either select them by either PAP or breast exam or colon screening. I'm just going to select the PAP and mammal due list. I am going to select my provider, Miss Amy again. I will put an Excel spreadsheet, and I'm going to click OK. Give it a chance. The system is now thinking, and it says yes, I want to open it. Okay, that's way better. Now you notice I have the PCM, last name, first name. I have breast exam date, PAP date, what date. I have colon screening, home phone, their address, zip, and beneficiary category. All the information I want. There again, I would recommend Excel spreadsheet versus HTML due to the fact I can save this and for future references. And there again, I can either do to PAP's list, breast exam list, or colon screen list. And this is what's so good about the prevention list. It will pull all your chronically ill patients and or people who are due CPS services. Any questions on the prevention report demonstration? Let's talk about the others list letter report. Okay. They can be used to create a population high-risk group so the clinic can send notifications, letter or cards, to patients that overdue CPS, clinical preventive services. And it pulls up patient demographics, cancer screening, chronic illness, diabetes, asthma, other cholesterol, HDL values, general output official letters, a criteria set, and a spreadsheet criteria. You can actually, if I just want to screen all my diabetic patients, you can make a criteria sheet or a list for diabetics or patients who need colonoscopies. You can make that criteria also, and you can make an actual spreadsheet for whatever situation you want. Okay, I'm going to go to others letters list on my menu tab in my PPM module. Now this is your population screen. Don't worry about the fuzzy image because I'm going to show you a live demonstration. Now this is if you're familiar with Excel spreadsheets, it's almost like an Excel spreadsheet. Very flexible. You can pull out any old information on your asthmatics, your chronic illnesses, your diabetics. You can see, if you look in the upper right hand corner, you can actually put an output, a rolling report, or create lab orders for them. You can also select letter format. and I will talk about that here in a minute. You can also save criteria. If out of this list here, under your criteria list, which is this whole area here, for your diabetic, asthmatics, other, chronic, demographic information, you can actually, if you want just chronically ill patient for reoccurring back pain, you can save this list and pull it up each and every time. Now, at this time, I already pulled one up, which is called a patient review contact list. And if you noticed, there again, don't worry about the fuzziness, is under the comments and contact type, a list pull says, I sent a report card to this patient, Andrew Demi, first one. Second one, Ashley Jack, letter sent. Okay, comments, letter sent for patients to come in and get blood work. This is a great report for you as a nurse or med tech to say, yes, we did contact our patient, they did not come in, or yes, they came in, took care of what you got to take care of, blood work is in the system. The internal med physician wants a list of chronic ill patients he sees in the clinic. You will need to provide a clinical service list of all chronic lists to organize a mailing list, and that's what we're going to do. Now we're back to my application. Go to others list. Now there again, you could do one of two things. You can go directly to where the list send letters, or you can review contact patients. Let's go to contact patients. Let's see what that one does for us. I will select Miss Amy again. This time I'm going to want I still want an Excel spreadsheet. I'm going to click OK. All right, it's asking me to open it up. Okay, now you notice that under my contact list, I got my patient's name, date contacted, contact type, and comments. This list is good to track patients that have been contacted or who have not been contacted. The information, once you write up a report and put into CHAS, in this portion, will track of who was contacted and who was not. And that is the review contact list. Let's go back. And I want to others send letters. Now this is that flexible report I was telling you about, which has all this information. If I want just a PCM, I will say Miss Amy. If I want my chronic patients, I want my asthmatics, I want my diabetes, depression, lower back pain, recurrent back pain, COPD, CHCF. That's all I want right now. Now, what this does is going to pull all my chronic patients required, but this is what I want to do. If we go to, we can do two more things. We look at the general output, right-hand corner, specific enrollment report, or create lab order forms for them. But that's not what I want. I want an official letter. If you notice in the middle box says official letter, hit the drop down. And I'm going to select for call within 45 days. I want to create a letter. I will open it up. And this is a blank form which you can fill out. But all the patients that you selected under your criteria, it will print it out for those patients. I'm going to select another one that I know for a fact. Nurse Managed Clinic. I'm going to create a letter. I'm going to open it up. And again, empty letter. Now, I want to make a comment on this official letter. If you have your own specific letter for your clinic, to have it entered into that portion of the little module right there is you have to get with the CHAS administrator. They're the ones that can document and copy and paste all those letters in there, whatever, however you want to do it. Okay, now down here at the bottom right hand corner it says Save Current Selection. You can, or uncheck the box. You notice criteria list, hit drop down. I can select any list that's already been created. Now, before you create a list, my recommendation is put it on paper first and figure out, okay, that's exactly what I want. Then select your boxes, check box, whatever information you want, and then save it, give it a name and save it. Because once you enter it into the system, the only way to pull it out is by going through your CHAS administrator. Okay? You notice you go to spreadsheet criteria. Now my spreadsheet criteria this is the information I want for my spreadsheet. Okay? I pulled all this information. Now this is from a general choice list to a specific choice list. Do I want retinal exam for my diabetes? Do I want my colorectal exam, my breast exams? Do I want my asthma choices like my steroid name, my output? Now we're talking about stats. And you can actually generate a spreadsheet for all this information. So again, if you notice that I have under add notes comment list, which I can, I'm going to load current population list. No records were selected. And you have to go back to selection criteria to pull that information. Any questions on the letters demonstration? You can actually print out diabetes cards, the 7th tier patients actually print out envelopes plus the letters. Any questions? It makes your job as a internal med clinic, as a family practice clinic, or any clinic that deals with chronically ill patients such as asthmatic, diabetics, hypertension clinic, to pull out your information without having to manually go through everyone's record and say, well, by the way, you're due this test, please come on in. Any questions on other list letters? Okay, move right along. The links description. This is a good little tab to look into because it goes to the other, it'll give you to other links to look up information for the prevention CPS services. And it's good. It's a good tab to look into. Let's talk about HEDIS measures. HEDIS criteria gets already set into CHAS for this application. It looks for people who meet the following criteria. For diabetics, age 18 to 75, to include regular exam, my LDL, my A1C, okay? My asthmatic patients from 5 to 56, you know, at least once dispensed medication. For my pap smear, 21 and 64 within 3 years. My breast exam, 52 to 69 within 2 years. My colorectal exam, between 51 and 80. And also a colonoscopy or an FOBT within 5 years or 10 years. This is your HEDIS criteria that pulls all that information out from. Oh, Ms. Linda, there again, you have to get with the, create that letter first. And then you have to get a hold of your CHAS administrator, and they can actually download it for you. That's their function, it's their job. Any other questions? Ms. Benton asks, do you have recommendations for cleaning up the data when the services performed outside the MTF or the doctor does not support coding to pull HEDIS data? Ma'am, Ms. Benton, that's kind of like a two-edged question because what affects CHS affects CHAS and vice versa, you know? Because if you have to correct it in CHAS, you also have to correct it in CHS. That's a system administration question. My recommendation is get with your CHS administrator and see if they can collect that for you in CHS first, and then see what CHAS can do for you by pulling that information or deleting that information. I hope that answers your question. Yes, ma'am. Data is pulled from past medical history. The data, all information will be pulled within the last 5 years in past history. I hope that answers your question, Ms. Dana. Mr. Frank says, I have a question about related to peer review reports. Can we stay on this presentation and discuss a question, or can you get your phone number? Oh yes, I'll let you have my phone number, my email, okay? We'll do that because that's one of the other modules I have to cover. Yes, Ms. Benton, you do have access to the training database. At the end of the slides, I will show you how to get access to that training database. They have videos, and we have the lesson plans here, that the overviews here on the ACE site, and I will show you how to get to that. Okay. Now, before I move on, any questions on what we just discussed? Primary use of proactive patient management, accessing the proactive patient management, identifying the 6 reports, creating a criteria list, saving a criteria list, exporting a criteria list as a spreadsheet. There again, for the end user, the PPM is a great application module to pull all your clinical preventive services patients and keep track of them. So that way they don't go sneaking behind your back to the ER for getting treatment when you should be taken care of. Okay, I know this is a hard question, but let's do a little quick review. It is, what are the 6 PPM reports? And they are the enrollee list report, the high utilizer list report, diabetes list report, the asthmatic list report, the prevention list report, and the other list users report. I cheated because I have the paper here in front of my face, so. Okay, Ms. Benton, for the training site, this is our Air Force CHAS video tutorial at http://www.afchas.com.community-pages-application.html. If any and everything we discussed during these training sessions, ma'am, you can find within the this Air Force website. It's a great website. And also, if you look on the bottom, it'll say documentation, DCO training, documentation on the bottom. And you will also find the handbooks there for each and every application. For us, this is for the OTS CMOSTS@amen.army.mil if you want to contact us, and also at our ACE site. And Mr. Frank, lucky for you that next month's CHAS topic will be peer review. And yes, I will give you my email address, and that we can ask me questions about it. Any questions about this session, ladies and gentlemen? All right, this time.